3 years later, the French woman who underwent the world's first face transplant says she is still struggling to come to terms with what she sees in the mirror every day. Isabelle Denoir said in an interview last month that it takes an awful lot of time to get used to someone else's face. It's a peculiar type of transplant. In a precursor to the U.S. operation, Isabelle was given a new nose, mouth and chin during surgery in France in 2005, and the operation worked. In spite of some signs of immune rejection, Isabelle soon regained sensation back on her face, and the operation continues to be a success. What does she see? Not her old face, but something that is halfway between what she looked like and what the deceased donor looked like.
The patient in France, when I had the opportunity to talk to her, she really was very excited about her new face and had absolutely no regrets.
It turns out that face transplants are more complicated psychologically for patients and even for doctors than any other transplant, and thus more controversial. The bold operation in the U.S. was carried out by reconstructive surgeon Marie Simoneau, a leader in the field. And as more of these operations happen, they give hope to people who would otherwise not live normal lives. As the first face transplant patient says of her new face, "It's part of me. I have the feeling of looking at something beautiful." Sheila MacVicar, CBS News, London.
We just heard in the piece that this can be psychologically complicated for both patient and doctor. Can you explain that a little bit to us?
Sure. Psychologically, I think the patient has to be adequately prepared to understand not only the complexities of what they're going to undertake, but the lifelong commitment that is attached to having a facial transplant. From the physician's standpoint, putting a patient through this type of surgery includes tremendous lifelong risks, and there are some alternatives to facial transplantation that we currently have. The risk of facial transplant rejection is really unknown at this point. The best estimate we have is from limb transplantation, which also includes skin and muscle and sometimes bone. These transplants have an acute rejection risk in the first year of about 10%. That doesn't mean that the limb is rejected. It just means that there may be an episode of rejection that has to be treated. And we think that this is going to be similar for facial transplantation as well.
So how do you decide who would be a good candidate for this or not?
I think we're still figuring that out, but I think that patients with severe burns that have basically scarred their entire face and limit their function to move the face, and patients who've had trauma and are missing significant amounts of their facial tissue.
In the final 20 seconds or so, it sounds like there are ethical issues here, no?
Absolutely. The questions of what side effects does a patient have to undergo in terms of having one of these procedures? I think the risks of immunosuppression are certainly at the top of the list. Infection, side effects of the drugs, and rejection. What do you do if the face is rejected?